Hello and welcome back to another episode on the channel by me, TheWiseJames. I'm just eating my dinner while listening to cowardly Kier talk about the NHS and how he's got a 10-year plan to sort it all out. I don't believe a word this man says. Literally, I don't accept anything he says as, one, he believes it, or two, as true. Like, he can't even reply to a letter, man. Never mind, sort this country out.
Always need hospitals. They will always be important for acute services in particular. But as I say, disease has changed and we must change with it. And not only can we do that, we can do it in a way that improves care and convenience for millions of people. So just imagine it, nurses, doctors, pharmacists, dentists, carers, health visitors, all under one roof, but also alongside them, services like debt advice, employment support, smoking cessation, preventative services, which we know are so crucial for a healthy life. Now that is an exciting prospect. You know, the idea that the future of healthcare is no longer defined by top-down citadels of the central state, but is instead in your home, in your community, in your hands. That is an inspiring vision of change. It will bring the state and the people it serves into a partnership on something that we all care deeply about. But more importantly, it means a future where we have better GP access, no more 8 a.m. scrambles, more dental care for your children, better care on your doorstep, and a neighbourhood health centre like this in our coastal towns, in our rural counties, in every community across the country. Every community across the country. Finally, the third shift, from the analogue NHS that we have at the moment to a truly digital health service, a health service capable of seizing the enormous opportunities that are there in science and technology, in genomics, in artificial intelligence, advanced robotics. And look, all of you will have seen in your everyday lives what this can do, and I've seen some of it as well. I've spoken to stroke patients whose lives have literally been saved by technology and AI because it could find the blood clot in their brain in milliseconds, giving them just enough time to be operated on and saving their lives. So this...
But when a man messages him about the fact the NHS tortured him for 3 years with forced injection, essentially because of medical negligence and police negligence, he didn't think it was worth his time to reply. So when literally a British citizen is contacting him over a level of medical negligence that is actually essentially a war crime, because it's human experimentation, right? Unconsensual human experimentation with forced penetration of dangerous chemicals. Like, for 3 years I was forced this injection. Each one of those injections could have killed me if it was done incorrectly. Each one could have killed me. And yet it was still forced on me with no reason. It was never going to cure me. Didn't help me. And Starmer knows about this. This is why I think he's a coward. Because, like, you can't sit there and pretend you care about, like, failures of the NHS when someone's writing you a letter about failures of the NHS and you don't even fucking respond. Yeah, bullshit. He's just a fucking liar. He's a pretender, a fake.
Plan, this 10-year plan, backs technology to deliver because it can and will save thousands of lives. But it's not just about saving lives. AI and technology is an opportunity to make services more human. That always sounds counterintuitive that AI and technology make us more human. But it does, because what it gives all of you and all of your colleagues is more time to care, more time to do the things that only human beings can do, which is that care that is needed, the professional skills that you have. So this will make it a more human service as well. And it's not just cutting-edge stuff. Technology like phones in the pockets of everyone in this room. We can make use of that as well. Now, It's not often I invite people to look at their phones when I'm making a speech. But if you get your phone out and look, you've got lots of apps on your phone. Seriously, because what you're going to see on your screen if you have a look at it is that entire industries have reorganised around apps. Retail knows the power of it, transport, finance, weather, you name it, shopping. Why can't we do that with health? Why can't we have that app on your phone? Why not the...
Because you can't even secure the beaches, let alone a fucking digital network, you prick. I could secure the digital network because I've got 20 years of experience with fixing computer network problems. He doesn't even understand a computer network. So yeah, we'll just make an app. That's fine. Until your security is shit and some terrorists hack the system and then have all the data of every health problem of every single person in the UK, and we all get exploited for the next 100 years with targeted attacks about a health problem. Fuck's sake. Some people are idiots. Now, if I could be sure that he could make a secure digital system, sure. But if the NHS track and trace is anything to go by, the British government has become useless at digital networks. Useless.
NHS app on your phone, making use of the same dynamic force to cut waiting lists at your hospital, to make it easier to book an appointment with your GP, to give you more control over our health. There is no good reason why we can't. And so I'm announcing today...
I just gave you all a good reason. The security concerns. That's literally the very reason why we don't have a digital voting system and a digital health system, is the security concerns. The data protection. That's the issue. They can't even secure the beaches of this country. The borders. How are they going to secure a wireless network from the best hacking organisations on the planet? He's out of his depth. He's a man from the world of cogs trying to live in the land of processors. Thinking he's still in the land of cogs. Fuck me. People of his age are out of their depth in the modern world. I'm sorry, they are very much out of their depth.
As part of this plan, that we can and we will transform the NHS app so it becomes an indispensable part of life for everyone. It will become, as technology develops, like having a doctor in your pocket, providing you with 24 hours advice, 7 days a week. An NHS that really is always there when you need it. Booking appointments at your convenience, ordering your prescriptions, guiding you perhaps to local charities or businesses that can improve your well-being. And perhaps most importantly, holding all healthcare data in an easily accessible single patient record. Now, don't underestimate just how important that is. I've been up to Alderhay Hospital in Liverpool many times. It's a children's hospital. It's a brilliant hospital. And one of the times I was there, I went onto the ward where particularly young children were having heart surgery. I have to tell you, it was really humbling, both seeing what the children were going through and what the professional staff were doing. And when I went into a particular ward, I saw a 2-year-old boy who had just had major heart surgery. It's an incredible thing to see. And I spoke to his parents, who were, as you would expect, at his bedside, where they'd been throughout. And one of the things they raised with me is the distress that they felt, that they had to go through every condition he'd had and what happened to him, how it impacted him over and over and over again, when they went to Blackpool, when they went to Liverpool, when they got to Alderhay. And they were actually welling up, telling me, it's a really difficult story for us. This is really hard. And we don't want to keep on having to repeat it. Why couldn't it have been...
I mean, that's a really good thing. Honestly, the amount of doctors and nurses and people I've had to repeat the same story to. And because you end up repeating it so much, you end up just overlooking certain details because you've already told 20 people that, so you don't tell the 21st person that. You give them the overview. It's like, I've had to literally explain to the NHS, to like 50 different staff on multiple occasions, the same damn thing. It's a fucking joke. Absolute joke.
recorded in some accessible form the first time round. And I will remember their faces and that story they told me for a very, very long time. And we can fix that. We can make it more accessible. We can bring this together in one place. And there are other examples as well. That red book that every parent gets when they have a child, why can't that be digital? There's no good reason, and so that is exactly what we will do. We will turn this app into a new front door for the entire NHS, a reformed, modernised and renewed neighbourhood health service. So that is the plan that we will launch today. That is the change we will deliver, the difference a Labour government makes. The NHS on its feet, facing the future, delivering fairness.
You still don't care about the NHS patients getting tortured under the Mental Health Act, Kier, so you're still a coward to me. Cowardly Kier, or Kier the Coward if you want. Your choice.
And security for working people. Thank you so much.
The all-new Whoop.
What a prick. He's saying what everyone wants to hear. He's not saying the truth. And the truth of the matter is there's massive security concerns with putting everyone in the UK's medical data on one database that can be hacked. They can't even secure our borders. How are they going to secure this digital network? Bullshit. They won't. They'll fuck it up like they do everything else. Bunch of doilums. Couldn't organise a piss up in a brewery. Anyway, see you later. Right.